Good morning, everyone. My name is Dr. Elisa Alvarado, and on behalf of the Region 1 Education Service Center and DHR Health, we would like to welcome all of our participating school districts to our PATS Middle School Virtual Healthcare Conference. Today, you will have the opportunity to hear and to ask questions of all different professionals. DHR Health has partnered with us, and in this conference, we are going to highlight a variety of different healthcare fields. This means that you'll get to meet professionals, not just doctors and nurses, but everybody on the team. Today, during our live session, I will be interviewing Mr. Ron Ozuna, and he's with pharmacy. Ron has always been very helpful throughout the conferences, and I can't wait for you to meet him. On behalf of Region 1 and DHR Health, we hope that you enjoy your day today and that you take advantage of all of the information that we have to share. Thank you so much.
The Rio Grande Valley, Texas, 1990 population, 450,000. In 2018, it was over 1.4 million and rapidly growing. For decades, South Texas lacked critical access to healthcare services. With the dynamic growth of the region, there was a mounting need for better healthcare. In 2003, local physicians came together to create a full-service general acute care hospital to meet that need. DHR Health, rising for you for life.
Carlos Cardenas, Chairman of the Board, Chief Administrative Officer. We are an acute care hospital that is open 24/7, 365 days of the year. We built this hospital so that we could be the very best physicians we could be. We were able to remove the impediments that got in our way that kept us from doing the things that we knew how to do. DHR is managed by the same physicians who deliver the care at the bedside in our hospital. We put the patient at the center of everything that we do.
It makes me a better physician to be able to work in a facility where every member of the healthcare team feels empowered to make the very best decisions for their patients. It's done that way here every single day, every time.
My name is Robert Martinez. I'm the Chief Medical Officer and Chief Physician Executive. So in the beginning, when we were working, most of us for out-of-town corporations, what we found was we were really having problems getting the things, the resources we needed to best care for our patients in the hospital.
Patients were denied the sophisticated services that were available elsewhere. Physicians were denied the means to treat the patients in the manner in which that they were trained to do so.
A particular instance I remember is when I had a really sick patient with abdominal pain, severe abdominal pain. I needed a CAT scan, I needed it quick, and I think there was a refusal of the administration at this particular hospital to hire the appropriate staff and have the appropriate equipment to be able to get that test done. That made me realize there was a problem.
At the same time that tens of millions of healthcare dollars were being taken from the community and shipped to out-of-state corporations.
So when you see an example like this, you really have to ask yourself, who really is benefiting from this healthcare? It sure wasn't the patient, and it sure wasn't the physician.
When I was growing up, we had to travel outside of our area in order to be able to get similar care to what we can provide here today. We had to travel to Houston, 350 miles away. We had to travel to San Antonio, 240 miles away.
The Valley has always been so isolated, both in terms of healthcare and economics.
I'm Dr. Bertha Medina, and I practice obstetrics at DHR Health Women's Hospital. We live in one of the poorest counties in the United States, and I think a lot of our patients don't have access to health care, perhaps until very late in their lives.
We decided to leave the old paradigm and create a new way to deliver healthcare, putting patients at the center of what we do, where the same physicians that care for our patients are the ones who manage our hospital and make the choices and decisions that deliver the highest quality care to the patients in our community.
DHR Health represents a unique model of medicine where physician leadership, the latest medical technology, and a keen understanding of the community are paramount for delivering world-class health care for South Texas. DHR is majority owned by the same doctors who treat patients every day. It's not a new idea. Historically, doctors would own hospitals. But over the years, corporate healthcare took greater control of hospitals, and the gap widened between doctors and their patients. More layers of administration bureaucracy were getting in the way of patient care.
Who better than physicians to be making choices and decisions about what equipment we should have, what nursing staff ratios should be, how a facility should be managed?
As doctors, we're at the bedside of our patients. We know firsthand what they're experiencing. If we have any difficulties with their care, we can take the problem to the boardroom and immediately resolve their issues for the betterment of their care.
Many hospitals, I think, in our country are run by out-of-state corporations. They answer to Wall Street. We are a community-based hospital that answers to Main Street.
It's all about the patient and the community you serve. If you're true to the community will be true to you.
Here in South Texas, we are the trendsetters. We are the trailblazers. DHR Health is a hospital that is being innovative in the delivery of healthcare.
Physicians want to help people. They dedicate their lives to alleviating suffering and pain. A physician-owned hospital? Well, that's a label. This is a hospital that is built for the community. This is a community hospital. DHR Health, rising for you, for life.
Good morning, PATH students, educators, and parents. My name is James Kurtz, and I am the Senior Vice President of Education and Employee Development for DHR Health. And on behalf of DHR Health, welcome to our virtual conference. We, here at DHR Health, are excited to have you with us today as we bring to you a bit of insight on healthcare and the careers you're likely to find within our hospital. This conference will showcase several of our healthcare professionals who will share with you their path into healthcare and what is it that they do to help our community. The need for healthcare heroes has skyrocketed in our region, and we need students like you to join our team in making a difference in the lives of others. So, for all of those students joining us today, we hope that you gain some valuable insight to what healthcare workers do and how every path is different, but ultimately gets you to be that change maker in our community. So, sit back, relax, take a big breath, and enjoy. Also, be sure to take lots of notes. We'll see you soon. Thank you.
Hi everyone, my name is Xochitl Mendez. I'm a respiratory therapist in DHR Health. My job here pretty much is taking care of everyone that has respiratory illnesses like asthma, bronchitis, chronic bronchitis, bronchiectasis, emphysema. Actually, an example of emphysema will be this pair of lungs that we have right here.